Let's talk about CPAP. CPAP works by blowing air in at a positive pressure that's blowing the tissues in our throat apart, and it prevents those tissues from falling against one another. So the snoring is eliminated, and because the airway is staying open, the individual is able to go through the full night cycle of sleep and get a good night's refreshing sleep. The bottom line is CPAP does work when people are willing to give it the good old-fashioned try, but there's a lot involved with it. There is a mask that the individual wears either over their nose and mouth, sometimes just their nose. Sometimes they're just little prongs that go inside the nostrils, which are much more comfortable. They're called nasal pillows, and the mask is then attached to a tube that's still connected to the device that's delivering the air. So there is a bit involved with the whole CPAP apparatus, but CPAP has come a long way over the years. It used to be super loud and it would bother the bedmate, but now the more modern CPAP devices are very quiet. So in addition to the device being quiet and the individual not snoring, their bedmate, the vast majority of times, is very happy that they're using the device. And the patient is usually very happy that they're using the device because they feel better.